And we'll begin with Senate File 3, Senator Clausen.
Well, good afternoon, Madam Chair and committee members, and thank you for the opportunity to present Senate File 3, which is a healthcare loan forgiveness proposal. As many of you know, healthcare is the fastest growing industry in Minnesota. In fact, it's actually outpacing the national average. And with this growth, we are facing a problem in that we're not keeping pace with industry workforce needs. And this is especially true in rural and underserved communities throughout Minnesota. To address this concern, Senate File 3 provides targeted loan forgiveness to healthcare professionals who agree to practice in rural and underserved communities. And this initiative is a result of two legislative actions, and I'm going to turn your attention to a slide here. In 2013, the legislature agreed to study mental health workforce needs, and we had over 30 mental health professionals meeting for 18 months. We conducted 20 community forums and outreach meetings throughout the state. We surveyed over 500 residents and held a mental health summit attended by over 150 professionals. The second initiative that I'll mention is ongoing. The 2014 legislature authorized a 2-year healthcare commission to identify current and anticipated healthcare workforce needs and those shortages, and also to evaluate the effectiveness of incentives to retain a highly skilled workforce. The commission met through the summer and fall of 2014 to develop preliminary recommendations for the 2015 legislature. And both groups recommended expansion of the existing health professionals loan forgiveness program to meet the needs of rural Minnesota and underserved communities. This expansion includes an increased funding allocation and the addition of mental health professionals, public health nurses, and dental therapists to the state loan forgiveness program. At this time, I would like to call upon Mark Schoenbaum, the Director for Rural Health and Primary Care for the Minnesota Department of Health. And Mr. Schoenbaum will identify the healthcare professional shortages in our state and outline the Minnesota Loan Forgiveness Program.
Welcome, Mr. Schoenbaum. Please introduce yourself for the record and begin your testimony.
Thank you, Madam Chair and members. Good afternoon. I'm Mark Schoenbaum from the Health Department. If you continue on in the presentation, you will come to a series of maps. And these maps show Minnesota's federally designated health professional shortage areas. This designation is certainly not perfect. There is no such thing as a perfect way to look at shortages, but it is widely used in common circulation. So it does give us a snapshot through one lens of our workforce situation in the state. If you look at the first map, which is about mental health shortages in Minnesota, you can see that almost the entire state is a federally designated mental health shortage area. And I'll just keep moving here unless people have questions. If you turn to the next page, you can see that similarly, almost the entire state is designated as a dental shortage area, especially for the low-income population in all of the colored areas on the map. And if you turn to the following page, you will see a perhaps more spotty but still significant area of the state is designated by the federal government as primary care shortage areas. And we at the Health Department do this analysis. The federal government actually makes the formal designations. The maps we've seen so far are of greater Minnesota, but if you keep turning the pages there, you will see that we have a similar situation in the Twin Cities, in the central cities of Minneapolis and St. Paul. This first Minneapolis-St. Paul map shows those areas that, again, are designated as dental professional shortage areas. And if you turn the page, it actually takes kind of two related maps to capture the picture for primary care in the Twin Cities. The map on the left looks specifically at the physician-to-population ratio for the low-income population. The map on the right, which picks up more of the story, also starts to bring in demographics about not only physician availability, but poverty, low birth weight, the kinds of demographic factors that contribute to health care demand. So that starts to fill in some of the details that Senator Clausen mentioned are reflected in the two recent health workforce reports. I'll now direct your attention. You have a handout in your packet called Loan Forgiveness Program, and tell you a little bit about the program itself. The first page gives you a little background and the budget history of the program, and if you flip it over, you will see on that left-hand column there a list of the occupations that are eligible for loan forgiveness incentives and the areas or conditions or high-need facilities where they must serve to receive those incentives. Putting kind of this page and the slide in front of us, side by side, we do know, having looked at this program in a formal evaluations several times over recent years and comparing it to the evaluations that are done nationally of these types of programs, that loan forgiveness does pretty convincingly seem to be an effective strategy to attract health professionals to the area where they are most needed. And not only does it attract them, but following them over the years, both when they are under that obligation and following, many of them remain and make a long-term contribution in their communities for 10 and often 20 years. So this program does appear to be one that works.
Turning to the next slide, just like to quickly review, there are three provisions that I'd like to share with you regarding Senate File 3. First is that increased funding for the Minnesota Loan Forgiveness Program. Secondly, it targets loan forgiveness funds to rural and underserved communities, providing an additional 200 care providers over 4 years to needy communities in our state. And then lastly, we're adding 3 health professional positions to the loan forgiveness program, and they are the mental health professionals, the public health nurses, and the dental therapists. The next slide you see gives you a little bit of a picture that Mr. Schoenbaum was talking about. It provides examples of the Minnesota Loan Forgiveness Program and its effect on student debt for selected professions. The chart includes the 3 professions that I've just mentioned that are being added to the program: the public health nurses, mental health professionals, and dental therapists. And overall, the forgiveness amount after 4 years is right around 60% of the total loan amount for all professional positions. And then the last slide, we just wanted to share with you. This was an article in the Minnesota Daily. It's a very supportive editorial article. And a related story, the first week of the session, Thursday of that week, we rolled out this bill. And later in the day, I had a call from a local television station. They wanted to run a program, a little story about it. By the time I called back, the person doing the story, they had been pulled off the story to cover weather in Minnesota. But it was rather interesting. They had already gone over to the Minnesota Dental School, and they had been walking the halls and talking to students who were just excited that they heard about this forgiveness program that we're sharing with you today. With that, I'd like some testifiers to come forward. First to be Sue Abderholden, Executive Director of NAMI, Minnesota.
Welcome, Ms. Abderholden. Would you introduce yourself and begin your testimony?
Yes, thank you, Madam Chair, members of the committee. Sue Abderholden with NAMI, Minnesota. We're here today to support Senate File 3. We think it's a great idea. As Senator Clausen mentioned, the 2013 legislature directed MnSCU to really look at mental health workforce shortages across our state. They released this wonderful report, which hopefully you all received. You know, I don't often go on and on about a state government report, but this one is one that you really want to read. I think it has some really good recommendations in it. And one thing that they point out is 9 of our 11 regions in our state are actually designated as a mental health professional shortage area. And another point I want to make is it's not just psychiatrists that we're short of, but all mental health professionals, especially in the rural areas. That includes clinical nurse specialists, clinical social workers, marriage and family therapists, licensed professional counselors, psychologists. We just don't have enough of them in the rural parts of our state. We can't have good health if you don't have good mental health, and so I think it's really important that we look at this issue. I'd also point out that even looking at the governor's budget, which really does expand funding for mental health services so that we improve access, we can't improve access unless we have more professionals working in the field. So we think that one of this recommendation to expand the loan forgiveness program is a good one. It's in the report. We had many people give input to it. Really hope that you support it. And I really want to thank Senator Clausen for his leadership on this issue and his commitment to it.
Thank you, Ms. Abderholden. Senator Clausen, did you have another person you wanted to testify?
We do. We have two people I'd like to introduce at this time. Dr. Catherine Mackin. She is a resident director at the United Family Medicine Clinic. It's actually located on West 7th, perhaps 2 miles from here, and I've had the privilege of visiting with Dr. Mackin and touring the clinic, and she'll share some information about the clinic and her work. And then we also have Dr. Sarah Eisencheck. She is currently doing her residency at the United Family Medicine Clinic. So we could call them forward, please.
Thank you. Welcome, Ms. Mackin and Ms. Eisencheck.
Perfect, thank you.
Thank you. Please introduce yourselves as you speak for the record.
Madam Chairperson and members of the committee, I'm Sarah.
And please pull the, whatever microphone might be there, right up to as close as you can, because we cannot hear you unless you do that.
Okay. Madam Chairperson and member of the committees, I'm Sarah Eisencheck. I'm a third-year resident physician at United Family Medicine. My rural roots run deep. I grew up on a ranch in central Minnesota. I attended the University of Minnesota Medical School in Duluth because of their strong history of training rural primary care providers. During my third year of medical school, I participated in the Rural Physician Associate Program, RPAP, in New London and Wilmer, Minnesota. That's a 9-month rural immersion program where I trained alongside rural primary care providers. I fell in love with the community, and I'm actually hired to join them after I graduate. At United Family Medicine in St. Paul, we strive to serve the underserved, both in urban and rural settings. As part of our second year of residency, we do 2 months of rural medicine. I trained in Mora for those 2 months and cared for people who sometimes would hike out of the forest and hitchhike into the clinic to see us to get their blood pressure medications. The poverty was remarkable. I, like many of my physician colleagues, have amassed a significant amount of academic debt, over $200,000. A bill like Senate File 3 would help to alleviate some of that financial burden, which certainly influenced a lot of my decisions moving forward. Thank you for your consideration of the bill.
Well, thank you very much for your testimony.
Madam Chairman and committee, my name is Kathleen Mackin. I'm a family medicine physician and director of United Family Medicine residency for 23, soon to be 24 years. We did start the program in '92 with the clear vision to train people for rural and urban underserved populations. I am happy to tell you that of our first 119 grads, that 40% of them are in rural family medicine and contributing across the state in significant ways. The only other thing that I will mention is that it is really critical that we do have that curricular component in the rural parts of the state, and also that I believe that the fact that United Family Medicine is a federal qualified health center really helps residents and our staff physicians both serve a very needy community, as well as be trained to serve people with complexity related to access, related to poverty, related to many social, economic issues, in addition to just having had minimal health care access. I too support the bill because I know, being a very senior family medicine physician, that these young docs are our present and our future and are very important to health of communities. Thank you.
Oh, thank you for your testimony. I would open it at this time for these testifiers. If there are any questions from members of the committee at this time, we can take a few questions now, and then open it up for the public to also have testimony for a while on the bill. Are there any questions from committee members at this time? I have one question, seeing none from the others. I did have my attention brought to a concern around, and I think that you are aware of this as well, Senator Clausen, about the population criteria established here as being a community or a city under 15,000 or under. And the issue that I'm hoping you will look at is how that actually plays out in some of the areas of the state. Some of the facilities or even the federally qualified centers are in communities that are above that number, and there are no cities that meet the criteria in certain parts of the state that would actually meet the criteria for this bill, according to the concerns I'm hearing from some of the rural legislators. Are you familiar with that, and are you in conversations about that?
Yes, thank you, Madam Chair. I am aware of that. I think we have 11 communities that fall into that category. I have not had an opportunity to talk to Mr. Schoenbaum about this, but we'll take that under consideration. Certainly look at that. That's part of that rural health loan forgiveness equation, and we'll certainly take a look at that.
I appreciate that. I know that this will be referred to higher ed, so I'll have a chance to hear back from you on what you've learned and what you recommend. Senator Marty.
Madam Chair, Senator Clausen, I know this isn't the right committee for discussing it, but I was just curious in terms of Section 4 appropriations, how much money is needed to make a significant difference in this area? I strongly agree with the need. I think it's urgent, and I think it's probably more money than is likely to happen. But what are advocates and you feeling is a thing where we're going to begin to make a difference?
Madam Chair,
Senator Clausen.
Thank you. Senator, I was trying to keep that a secret, knowing that Senator Laurie would be in his committee. But we're looking to place 200 professionals over 4 years in the state. We're looking at $3 million.
Thank you.
Senator Rosen.
Thank you, Madam Chair. Senator Clausen, I'm not sure if this question could be for you and maybe Mr. Schoenbaum too. But did you look in your travels around and all the work that the Governor's Task Force on Child Protection, did you look at the social worker? I know that there's the clinical social worker as part of the mental health, but that is not necessarily all the levels of social worker. And would they be able to tap into this loan forgiveness program?
Senator Clausen.
Madam Chair, Senator Rosen, we're taking the recommendations of the two study groups. Mental health certainly addressed that in their description of a psychiatric social worker. We have not gone beyond that. So we're basically taking the recommendation at this time of the two groups. As I mentioned, the second group that former Representative Huntley and I co-chaired over the summer and fall, we're continuing our work for another year and a half, and so that could be something that we'd further look at.
Senator Rosen.
Yes, thank you. Follow up. Well, Senator Clausen, I do have a bill for social workers and loan forgiveness. And because it's become very apparent in the work of that task force that we have issues with retaining social workers, especially out in rural and deep rural areas.
Thank you.
So.
Any further questions? Senator Nelson.
Thank you, Madam Chair. And Senator Clausen, thank you for bringing this bill forward. I am intrigued and happy to see the inclusion, I understand, on lines 3.5 and 3.6 of including hospitals that would be operating nursing homes. And I'm just wondering if you can clarify exactly, does that mean the nurses are in the nursing homes? What's the exact result of the language that you have in 3.5, 6, and 7?
I'm going to ask Mr. Schoenbaum to come forward. I don't want to misspeak on that. So I'm going to have Mr. Schoenbaum.
Madam Chair.
Yes, Mr. Schoenbaum.
Senator Nelson, good eye on that change in, proposed change in the language. The loan forgiveness program, through the priorities that the legislature has set over the years, establishes kind of the high priority areas where the state wants to provide incentives for people to practice. For registered nurses, along the way, the law requires that to receive loan forgiveness, a registered nurse must work in a nursing home or a facility for the developmentally disabled. I think Senator Clausen found during the Workforce Commission process that there are numerous workforce challenges in the long-term care sector, including the pay differential for nurses between nursing homes and hospitals. So the existing limitation in the program that a nurse must only work in a nursing home helps attract and retain nurses in nursing homes, but the commission heard that if there was a little more flexibility so that if there's a combined campus, a nurse could work kind of on both sides, that that might be another aid, another incentive to retain the nurse in that organization while they were receiving loan forgiveness and after. So that's why that's there.
Senator Nelson.
Thank you for actually that flexibility and clarification. We have a great shortage of nurses in our long-term care facilities, and anything we can do to encourage that, I think, is of great need. And then I have one final question, Madam Chair.
Yes, then we will move on to public testimony.
And I'm just wondering, I was looking for the definition of the dental health professional shortage area and the primary care health professional shortage area and the medically underserved areas. And I'm looking at those little insert maps of Minneapolis and St. Paul, and I'm just wondering, what was the designation, or how were you able to put together these particular areas in Minneapolis or St. Paul as being underserved? What kind of metric was used there?
Mr. Schoenbaum.
Madam Chair and Senator Nelson, the criteria are listed on the statewide maps in the preceding pages, the ratios of healthcare providers, and the same criteria are used in urban areas as well.
Thank you. I don't see that on here, but it must be in a different document. Thank you very much.
We're going to move to public testimony right after Senator Benson asks her question. Sorry. I didn't see her hand before I made that announcement.
Sorry, Madam Chair. I could have waited till the end. I was just looking at the findings from MDH research in 2014, and pretty good retention from loan forgiveness. The dentists, there seems to be quite a fall off compared to other categories. And so has there been any review of how we could incent more dentists to stay in these critical areas if they've taken part in the loan forgiveness program?
Mr. Schoenbaum.
Madam Chair and Senator Benson, the law requires that to receive loan forgiveness, a dentist must agree to provide at least 25% of their visits to medical assistance or sliding fee scale patients. And we know that there is a major dental access challenge in serving those low-income patients. So similar to the kind of the immense pressures in nursing home employment, there are similar pressures in serving low-income dental patients. The program does have a retention effect. It's not as strong as in some of the other occupations because of those huge external forces that are also at work.
Thank you, Madam Chair.
Thank you. Thank you very much. I'd like to open it up now for anyone in the gallery that would like to... Oh, I guess we have a list. Sorry. We'll start with Tricia Stark, who's the Minnesota Psychological Association. This will be followed by Shauna Rettmeyer, I think it's Rettmeyer, who's the Executive Director of Northwest Mental Health Center. Would you please come forward now, Shauna, so that we can take advantage of our time? And then, Tricia, as you've completed, if you'd step away, then Kate Dean can come forward from the Health Science and Medical Education Essential Health. Thank you.
Madam Chair, committee members, my name is Tricia Stark, and I represent the Minnesota Psychological Association. I just want to take this opportunity to thank Senator Clausen for his leadership on the Mental Health Workforce Summit and the Mental Health Workforce Report. The recommendations for loan forgiveness for mental health professionals who work in rural settings from those reports and reflected in this bill are critical, and I would urge you to support them. As you've heard before, 9 of 11 regions of Minnesota are designated as mental health workforce shortage areas, and loan forgiveness is an effective strategy to increase the workforce of these shortage areas so that critical services such as mental health crisis response teams and things like that can be filled and function effectively. Thank you.
I thank you for your direct and to the point presentation, Ms. Stark. Please introduce yourself and begin your testimony.
Madam Chair, committee members, my name is Shauna Reitmeyer. I'm the Executive Director for the Northwestern Mental Health Center in Crookston and just drove 5 hours to come here today to see you. I'm here on behalf of the Minnesota Association of Community Mental Health Programs. As a rural and frontier community mental health provider, we serve Kittson, Marshall, Polk, Norman, Mahnomen, and Red Lake counties. We are approximately the same geographical size of the state of New Jersey. However, the difference with that is New Jersey has about 1,200 people per square mile, and we have 8. Because of that, of the rural and frontier nature of our region, and as the primary mental health safety net provider for very chronic mental health patients, finding qualified professionals and retaining them has been a challenge. Even though we have been successful with the National Health Services Corps in that loan repayment program, that also poses its own limits. And this bill has the opportunity to fill the gap where those programs lack at this time. For example, allowing mental health professionals to provide services in school-based settings or within the community where individuals live in their home. Being able to provide additional telehealth services under this program, along with expanding the educational institutions that qualify for individuals to be eligible for this program. The success and recovery of individuals with mental health issues requires the provision of services to be located where they have access to those services. And for those, that means where they live. It means how much gas they can put in their vehicle in order to get to those services, or providing those services to where our children reside most of their time, and that's in their schools. The Northwestern Mental Health Center and the Minnesota Association of Community Mental Health Programs supports this bill, and thanks Senator Clausen for introducing it. This can bring needed resources to our rural and frontier communities like Northwest Minnesota. Thank you for your time.
Thank you, Ms. Reitmeyer, is it?
Reitmeyer.
And I want to say especially thank you for bringing the voice of that part of the state to the Minnesota Capitol. And I heard what you said, that you drove 5 hours to come here to have a very brief time to tell your story. And I'm hoping that if there are questions for you at the end, that we'll have time for you to tell more.
Thank you.
Thank you. This is Kate Dean. And would Jean Anderson from the Dental Hygiene Educators please approach? Please begin and introduce yourself and start your testimony.
Madam Chair, my name is Kate Dean. I'm the Director of Health Science and Medical Education at Essential Health. And I thank you and the committee for the opportunity to speak today. I have submitted my comments in more detail that you should have in your packets, and in the interest of time, I'll be very brief. This addresses workforce issues that are very important to Essentia Health. We are an integrated healthcare system that has a strong presence in rural northern Minnesota. We applaud and support a loan forgiveness program designed to encourage healthcare professionals to practice in rural Minnesota communities. We do ask that the committee consider the inclusion of general surgery residents in this proposed program. There is a serious need for general surgeons in rural communities. The Minnesota Rural Health Advisory Committee's 2011 report stated that there were only 23 general surgeons practicing in rural Minnesota counties. Additionally, about half of those surgeons were going to retire in the next 6 to 10 years. So including general surgery residents in this loan forgiveness program helps us sustain a rural healthcare delivery system. Also, as we grow our healthcare workforce, finding clinical training opportunities is becoming increasingly difficult. This bill can help us increase training capacity because it is linking eligibility for the loan forgiveness program to a teaching requirement for several of the professions. While we support this in spirit, we would like the committee to consider dialogue around 2 areas of concern. First, it is our belief that there is a significant need to increase the number of clinical training site instructors. We propose specifically identifying clinical placement teaching rather than general teaching hours as eligibility criteria for the program. Second, in our experience, both healthcare systems and academic institutions prefer that providers have been in practice for 2 to 3 years before they take on a student to start teaching. Further discussion regarding how that teaching requirement can be supported in this proposed 3-year service obligation is recommended. Madam Chair, in closing, if there is an occasion to provide more detail or to engage in further conversation regarding this bill, Essentia Health welcomes the opportunity. Thank you.
Thank you very much. I'm sure, Senator Clausen, that you'll have these conversations. And would you like to speak to this at this time?
I would. Thank you, Madam Chair. Just for your information, we do have a second bill that will address some of Ms. Dean's comments that she made. So you'll be getting that shortly.
And so the issues in the second bill related to preceptor and training, teaching, and
clinical sites, and expanding residency slots throughout the state.
Thank you. Thank you. Thank you for your testimony. And Ms. Anderson?
Madam Chair, members of the committee, I'm Jean Anderson. I'm on the faculty at the University of Minnesota Dental School, and I also represent the Minnesota Dental Hygienist Educators Association. I'm here to support the addition of the advanced dental therapists and dental therapists in the bill, but I also would like to point out to the committee that there's an essential preventive specialist missing, and that is dental hygienists, and in particular, dental hygienists who are allowed to practice with limited authorization according to 150A.10 subdivision 1A, which allows dental hygienists with a collaborative management agreement, much like the advanced dental therapists, to practice without the supervision of a dentist on site. So a similar situation. And they provide services that really no other oral health care provider can with their periodontal therapeutic services as well as preventive emphasis. I'd also like to point out their debt incurred, especially for a bachelor degree program, ranges from $27,000 to up to $75,000 for a 4-year program. In addition, we seem to think that, and we know that dental hygienists have trouble getting jobs, so it seems like there aren't a need for them in rural areas or in underserved areas, but that is really incorrect in that we need to provide and create opportunities in new places, and a collaborative practice hygienist with limited authorization can do just that. So I would encourage you to think about adding dental hygienists, and particularly limited authorization hygienists, to this bill. Thank you very much.
Thank you very much. I'm certain that Senator Clausen is including that. I do remember the hearings. We were, many of us here, on the hearings that developed this expanded role for dental hygienists. It was very specific to meeting some of the need in the underserved communities, and the research and the data demonstrating competency as well as safety were substantial. So I encourage you that if there is a reason for restricting them, it can't be based on competency or ability to work within their scope of practice. Okay, that concludes our list of testifiers. I'll just check and see if there's anyone else. Seeing none, would somebody like to move Senator Clausen's bill for him, Senate File 3?
We have others?
There is a quorum present.
I'll move it.
Senator Marty moves Senate File 3 for Senator Clausen and refers it, I think, to higher education is the first stop. Any further discussion? Well, thank you very much for your testimony. We really did a nice job of doing this within the time we'd allotted. I know. I just wanted to say thanks before we took the vote. Appreciate it very much. So all those in favor say aye.
Aye.
Opposed? Passes. Thank you very much.
Thank you, Madam Chair.